Rachel, explain to everybody who you are and what you do for a living.
Okay, so I'm Rachel. I work at St. Clair Hospital. I'm a nurse. I went to Waynesburg University for nursing, 4-year program, got my bachelor's in nursing. I started out working at Uniontown Hospital in labor and delivery. And when they closed down their labor and delivery unit, I went to St. Clair. So the unit that I work on, we do a little bit of everything. Some hospitals do a little bit differently, but how we do it is I do labor and delivery. I do antepartum, which is when patients are still pregnant and need some kind of observation. We do C-sections, and I circulate in the OR the whole time for the C-sections. We do the post-op kind of like PACU type recovery stuff after C-sections. We also do the postpartum care of the mother and baby after they have their baby. So we take care of them the whole time they're there after. And I'm also trained to work in our level 2 nursery, which is like a NICU, but we just do very minor things. If they need a higher level of care, we transfer them somewhere like Children's Hospital in Pittsburgh, places like that. So some hospitals, you just work in one area, but smaller community hospitals, they usually train you to do a little bit of everything.
So what is your average day like?
So we walk in the morning and there's usually an assignment sheet, and it kind of depends on how the day is. So you look at the assignment sheet and you can be staffed to do someone who's already there in labor, or you could have someone who is coming in for an induction of labor and you have to get everything started. You could have an assignment of a bunch of postpartum mothers and babies, or you could be in the level 2 nursery. A lot of times I am in our level 2 nursery with the sicker babies. So it kind of all just goes on what you're scheduled for the day, and you go from there. If you have an induction, you're one-on-one with that patient the whole day. You're getting them fully admitted, you're starting an IV, you're getting all of their blood work, you're making sure everything's set up and ready for baby. You're making sure that your pediatrician knows anything that they need to be ready for once this baby comes, and you're pretty much one-on-one with that woman the entire day. You are constantly watching their baby's heartbeat on that monitor. You never look away from their heartbeat ever. You're always watching it. If you step away, someone else needs to be watching it. So it's very one-on-one with them. And then if you are doing something like postpartum, it's not as one-on-one because those patients are a little bit more stable once they've delivered. So sometimes you will have, we consider them couplets, which is the mother and baby. You'll have 3 or 4 of those, and you're just taking a lot of vital signs, helping them with feedings, helping them learn how to take care of their baby, all of that stuff. In our level 2 nursery, if you're in there for the day, which is where I do spend a lot of my days, our babies are usually on an IV. They usually have IV fluids because their blood sugar was low, or we think they have some sort of infection. So we're watching their blood sugar levels very closely. We're giving them antibiotics. Sometimes they need some oxygen therapy for a short amount of time. So we're constantly watching all of their vital signs and watching if we need to go up or down on their oxygen, things like that.
So how much do you interact with the families of the patients?
Like the families of the mother or of the baby?
Of the mother.
Of the mother. With right now with COVID, not too often. Prior to COVID, it was a little bit more intense because all of the family wanted to be there, which I get. But we are allowing, they can have their support person, so usually their husband, and they can have one other person, which we find a lot of the time is the patient's mother, so the grandmother. So they are there a lot and asking a lot of questions. They want to know everything that's going on. Sometimes we do have them call in, but we can't really give them too much information over the phone. Where I work, it's very nice because my patients usually aren't sick. So they can talk for themselves. They can talk to their family for themselves. So that does make it a little bit easier compared to other fields of nursing because they truly aren't sick.
So either being at Uniontown or St. Clair, have you ever dealt with a difficult patient?
I'm sorry, I couldn't hear you.
Either Uniontown or St. Clair, have you ever dealt with a difficult patient?
Yes.
And how did you deal with that difficult patient?
I would say truly some of the more difficult patients I did have at Uniontown more than St. Clair. At Uniontown, we did tend to see a little bit more of patients who did not get a lot of prenatal care. So they had like nothing, we knew nothing about them, nothing to take care of their baby, nothing like that at all. And unfortunately at Uniontown, we did see a lot more patients that would come in and be on some type of drug. So obviously when they can't use the drugs that they're used to in the hospital, they get very angry with you, very upset with you because they start to withdraw. They don't understand why they have to stay there and they can't leave. And they just get very, very mean and mad. But the best thing, you obviously can't let them leave and do anything outside because you have to think about that baby that's inside of them. So it can be very difficult, but you just have to kind of sit back and think, what they're going through. Obviously, it's not right that they chose to use the drugs during pregnancy or anything, but they're also withdrawing and going through something difficult. So you just kind of have to be there and support them. They're still scared regardless. They're having a baby. It's a scary process. It hurts. So you just kind of have to always step back and think about them, think of things from their point of view, and just try to support them the best you can.
So the mothers that come in on drugs,
Mhm.
how are the babies affected when they're born?
It's very interesting because it truly varies with every baby. You never know what to expect. The ones that you think could have worse side effects don't. You never know. So if they're on some type of opioid, we can give the babies morphine to help them with the withdrawal. Other drugs, there really is no way to help the babies through it other than just like consoling them and being for them there. So anytime a mother has a positive drug screen when she comes in, we automatically are keeping that baby in the hospital for 5 days after they deliver. We do something that's called Finnegan scoring. And it is like it has a score range where we look for different things to see how badly we think this baby is withdrawing. It's hard because this baby can't talk to you. They can't tell you how they're feeling, anything like that. So we look at things like if a baby is sneezing a lot is a sign that they're withdrawing. If they're not sleeping, they're not eating, they're having a lot of really loose stools, things like that. Once they start to score higher on the scale, then we look about, do we need to admit them to our level 2 nursery? And when they get that high, we do put them in there and we start them on, it's oral morphine. They're very, very low doses for babies. It's like 0.3 mLs that you give a baby orally. And we continue to watch their scores and we see if we need to go up or down on their morphine. And so hopefully we can get them off of it and home. If they would need it long term, we would transfer them somewhere like children's where they have a bigger NICU and can help them better. But then the other side of that is the social aspect. So when a mother has a positive drug screen, then we're involving people like social services and children and youth services to see, is it safe for this baby to go home? How can we help this mom? How can we help this baby? So there's a lot that goes into it to make sure they're all safe.
So with dealing with the babies that are coming down off of the drug, did you learn about that in school, or how did you learn to deal with that type of situation?
We did learn about it a little bit in school. They talk about it, but they don't go super in depth with it. So it's kind of just learning a lot of it on the job. And you do have some patients who are on some sort of treatment program for the drugs, like they're on methadone or Subutex or something like that. So they completely understand. They've already gotten through the worst of their like drug addiction with illegal drugs like heroin or something that they were used, and they've gotten themselves into a treatment program already. So they kind of know, they understand what it's like for their baby to go through the withdrawal process like they did at one point. And they are kind of set up. We talk to them ahead of time before they come in and deliver, and we tell them what to expect. So for them, it's usually a little bit easier. But when we do have women that come in and had no prenatal care, have just tested positive, like they just used heroin or cocaine or something like that, that does make it a lot more difficult to deal with for us to deal with the mom and for the mom to understand why the baby has to stay and go through all of this as well.
You always have good days at your job.
No. Usually I do really like my field because for the most part, it is happy nursing. The patients usually aren't sick. You get to be a part of the best day of someone's life, but there unfortunately are very bad days. When it's a bad day on labor and delivery, it's about the lowest low you could ever feel. sometimes babies don't make it. Moms come in and they say they haven't felt their baby move around as much, and you try to put them on the monitor to check and there is no heartbeat. It does not happen too often. I would say most days are happy days, but when they're not, they're the worst of days you can ever imagine.
You bring your work home with you?
I try not to, but it's really hard. It's been really hard not to.
Okay.
We've been at, just like everywhere else, there's such a staffing shortage everywhere. So we're very stressed, very overworked right now. So many patients. We're seeing, yet again, we're seeing a very high increase in COVID right now. So we do have moms who are sometimes a little bit sick, then we have to watch the babies closer. So it's been a little bit more difficult now than it ever has been, just with extra level of stress and things like that. So I try not to, I really do. And it does kind of help that I now have a little bit of a longer drive. So I can kind of de-stress, decompress, think about my day on my way home. So I try not to, but it's very, very hard not to.
So when you're in that type of situation or in that mood, how do you get yourself out of it?
What was that?
When you are in that, when you've had a bad day, how do you get yourself out of it to go back to work tomorrow?
Oh, it's hard. It's very hard. Where I work with a great group of people, which I have on every unit that I have worked on. And it's very much like a family. So we just kind of all are there for each other. So that's kind of what makes it like able to go back, is we all support each other. We'll text each other and say, are you okay? Do you need to talk about anything? Our directors are really good about coming to us if we need to have like a debriefing session or things like that. So that's what makes it a little bit better. But even when you have the worst day, you go back the next day and you're there and you're a part of the best day of someone's life. Someone is having their first baby after they've tried to have a baby for 10 years and they're just so happy. And then you realize again, why you're doing this, why it's all worth it.
So why is it worth it to you to do it?
It's just really amazing to be a part of the best day of someone's life and to support them through this. It's such a amazing change to watch someone go through. You'll have these dads come in who look like these big tough guys, and they come in and as soon as they see that little baby, they just start crying and they want to know everything they can possibly do to take care of it. It's really amazing to watch the change that happens in someone the second they have a baby, and you're just a part of the best day of their life, and their life is forever changed.
Anybody have any questions? They're quiet. The patients that you deal with at St. Clair, are they much different than they were at Uniontown?
Yes, a good majority of them are. I would say that I find at St. Clair, a lot of the patients are older. A lot of them, which there's no right or wrong way to decide when you want to have a baby or a family or anything. It's all up to you. But I would say that a lot of the patients at St. Clair are more in their like early 30s. They have already established a career. A lot more of them are married. And they just seem like they got all of those steps in life first and then had a baby. But we do still have some young moms. I would say at St. Clair, we don't see as many teen pregnancies as we did at Uniontown. So it is a little bit different. We don't see as many patients on drugs at St. Clair, but we still do see them here and there. So it is a little bit different.
So would you recommend this field for anybody?
Yes. Well, you have to be able to really be there for someone. It's a lot of one-on-one care. It's a lot of, these patients are in pain. When they're in labor, they're in pain, and you have to be there one-on-one. There are a lot of days where I don't take a break. I don't eat lunch, and they will try to get me to, and I'm like, I can't leave my patient. She's in too much pain. I just can't. So, it is a lot because you kind of just have to forget about yourself and your whole life for the day, and you're just diving full in on this patient. But it is very, very rewarding, and the highs definitely outweigh the lows.
So you would recommend it to anybody?
I think so. As long as you have a good heart and you're caring for it. And with nursing in general, though, there are so many different fields. Labor and delivery is a very specialized field, and you have to really want to do it. but nursing in general, there are so many different ways you can go with it. So I think nursing is an amazing field to get into.
So when you went to college, did you look at labor and delivery or were
No.
you looking, no? How
Nope.
did you get into labor and delivery?
I never ever had labor and delivery on my mind at all. I really didn't know what type of nursing I wanted to do. And they always tell you that you should just start out on the general floors and just get a feel for it. But I knew I kind of didn't like that either. And it wasn't until our junior year that we kind of got exposed a little bit to labor and delivery nursing, pediatrics, all of that. And I really liked it, but I still wasn't convinced. And then we went through all of our other rotations like psych and everything else, and nothing else interested me the way labor and delivery did. So I was like, I think this is what I want to do. So I figured I would give it a try, and it was the right fit. I love it.
Now, your, I don't know what to call Brennan. How many days is it now? 2,600 and what?
Oh, it's probably like 2,610 or something now.
Okay, because when it gets to 3, we need to talk.
Yes.
Anyway, he's also a nurse.
Yes.
What type of nursing does he do?
He does emergency room nursing at Uniontown.
So what happens when both of you have a bad day? How do you
His
guys
days
get
are always
through it?
way worse than mine, I will say that. But a lot of times, we'll come home if we both have a bad day and we both worked, and we'll just eat dinner, just kind of decompress about it, eat some dinner, go out to dinner, go out somewhere, watch some TV, just try to not think about it. It is kind of nice having another nurse because we do talk about our days more in depth and kind of understand a little bit more what each other are going through during the day. So that does help a lot. But then at the same time, we do kind of try to get away from it if we can. But I do think it really helps to have someone who does understand what it's like.
So would you recommend going to school at Waynesburg University?
Yes. Yes, it was a great school. I loved it. They actually were just ranked the top nursing program in Pennsylvania again.
And Brennan went to Penn State.
Penn State Fayette, yep. And he
So-
really liked it too.
Okay.
So I think that sounded like a great program as well.
So before I let you go, is there anything you want to share with my students?
I don't think so. Do they have any questions about nursing or the field or anything?
Anybody? No, they're all sitting there quiet, and the one that wants to go into nursing is just sitting there looking at me like, I don't have any questions.
Well, if she has any questions, you can always connect her with me and I'd be glad to answer anything.
Okay. Rachel, thank you very much. I
You're
really
welcome.
appreciate it.
You're welcome. All right.
Bye. Oh, stop.